Everyone, welcome to the Nurses Heartbeat. My name is Philip, and we are looking at the last part of the diabetes series, complications of diabetes. Why do they happen? How do they happen? And what can be done? The good news is that even though diabetes has a lot of problems that it can bring, there are things that you can do to prevent the complications. Most of the complications are preventable. When you take early steps, you can prevent yourself from getting these complications, whether it is type 1 diabetes, type 2 diabetes. You can still work your way out to prevent yourself from getting the complications that come with diabetes. Why do the complications arise? Now, high blood sugar in your blood affects your blood vessels and affects your nerves. And when this happens, the blood vessels, they supply the blood to various organs of your body. So they supply blood to your brain, to your heart, to your kidneys, and many other organs of your body. And when these nerves and these blood vessels that serve as channels, that serves as pipes in the body to carry the blood to the various core organs of the body, when these blood vessels damage, then it means that there is going to be a lot of damage to you. So areas that diabetes will affect as a complication can affect your eyes and lead you to blindness, what we call diabetic um, retinopathy. So diabetic retinopathy means that your eye is affected because of the diabetes. Diabetes can affect your brain, can give you stroke. Diabetes can give you high blood pressure. Diabetes can give you kidney disease and a lot of diseases. So I will quickly go through each of them in a bit, and I will let you know what you can do to keep yourself from getting this complication associated with diabetes. And so let's look at the first complication I want to talk about. That is eye complication, that is diabetic retinopathy. So as I have said, when you have diabetes, there is blood sugar accumulation in your blood. So there is high blood sugar in the blood, and this one is going to damage your vessels and damage your nerves. And when this happens, it's going to lead you to having blurry vision. You are going to have vision loss and then vision problems. And this is when not taken into consideration, when the necessary action is not taken, you can become blind as a result of diabetes. Now, there are so many it goes unnoticed. The early stages have no symptoms, and therefore screening is very, very important. If you have diabetes, the eye screening should be a key to you, because the symptoms, they come unnoticed, and then you may end up delaying yourself from having checked for eye condition or eye problems. So what you have to do is to do screening, eye screening, to make sure that you are not developing any eye complication. The second complication that comes, the second problem that comes with diabetes is kidney disease, what we call diabetic nephropathy. So your kidney is going to malfunction, your kidney is going to be affected, and then it can affect you. You can have a kidney shut down at all. So that is the second diabetes, and it comes with the same principle. The blood vessels to the kidney are damaged, so blood supply to the kidneys, everything is stopped, and then you are not able to, your kidney is not going to work well. So there is kidney disease with that. And then early signs of kidney disease, you will see swelling in your feet, you will see foamy urine. You know that the kidneys also really helps you with the blood mechanism, the blood control, how blood works in your body. So if your kidney is affected, then your blood pressure is going to be affected. You are going to have hypertension as well. So good kidney function is silent, protected before it becomes loud. So what you have to do is to always make sure that you are protecting your kidneys. How do you protect your kidney? protecting your kidney means that you make sure that your blood sugar is controlled. So you have to check your diet. You have to make sure you are eating good diet, good nutrition, as we've talked about in the previous video. You have to make sure that you are keeping your blood sugar in the correct range. You are doing checkups to make sure that there is no too much blood sugar accumulated so that it doesn't destroy all the vessels to the kidney. That is how you should protect it. You make sure that your medications you are taking, you take it religiously, you take it as prescribed, so that is going to help you. Then the next complication is nerve damage and foot problems, neuropathy. So many people that have diabetes have problems with their foot, and this sometimes could lead to amputation. There is slow wound healing. When you have wound at your foot, you have wound at any part of your body, because the nerves are damaged and the vessels are damaged, then there is going to be slow wound healing. So if you are diabetic and you have any small cut or wound, then you should take good care of it, because if not, it's going to lead you to something big, something bad, because there is slow healing. So you have to make sure that you don't subject yourself to activities that will predisposing you to having cuts and to having wounds. It is very important. What are signs that there is problem with your nerves and with your foot? You have tingling, burning, and numbness. So sometimes your foot will be numb, you wouldn't feel yourself. There could be tingling sensation there. Sometimes there is reduced feeling, as I've said, and then that leads to increased risk of injuries. So there are people that, because the nerves are damaged, when you touch something, there are some people that even when they step on a hot object, it takes a lot of time for them to realize it. That is a reduced feeling, and that can cause you, that can make you hurt yourself quite easily. You have to do is daily foot check. You make sure that you check your foot, you check your body, you make sure that there are no wounds. If you've seen any cut, you take steps to make sure the cuts are clean. You put the necessary dressing on it. You make sure it is checked. Okay, don't leave any wound unnoticed, and don't ignore any small wound, because it can hurt you a lot. And make sure that you protect yourself so you don't get to the stage of being amputated. And then the next aspect that I'm also looking at, the complication, is heart disease and stroke. As I have said, blood vessels supply the blood to your brain and to your heart, and when they are damaged, you are going to have um, loss of blood supply to the brain, and that will lead you to brain cells death, and that will cause stroke. You've seen so many people having stroke. One of the cardinal reasons is diabetes. It can lead you to stroke and heart disease. Now, insulin regulates fat metabolism, how fat is utilized, or how fat works in your body. So when insulin is not working properly, then there is accumulation of fats in your body. The good fats is reduced, and there is more bad fats accumulated in your body that builds up, and it is going to affect your heart muscles. Also, we've said that the vessels that supply the blood to various organs, including the heart, is damaged. High blood sugar can damage the vessels. Now, when that happens, fats also accumulate at the damaged parts of the vessel, and they block the vessel. So blood is not able to be supplied to the heart, and this can lead you to heart conditions. When your heart is not getting the enough oxygen it also needs, then heart damage will also set in, and that can affect you as well. So you could have high blood pressure, you could have high cholesterol, as I have explained, you could have heart attacks, you could have stroke, All those are complications that can affect your heart and your brain when it comes to diabetes. And then heart health and blood sugar are deeply connected. So you make sure that your blood sugar, the key thing is if you are diabetic, make sure it's always in the range. Make sure you are having the good exercise, the good diet, you are taking your medications, you are having regular checkups, you are having regular screenings to make sure your blood sugar is controlled so it can prevent most of these complications. Now, another complication I'm talking about is gum disease. Gum. Now, high sugar increases bacterial growth, as I've said, as the bacterial growth increase and they are delaying your wound healing. In the same way, the bacteria in your mouth, their growth also increases and can lead you to gum infections and tooth issues. So you have to be taking good care of your mouth, your teeth, brushing, flossing, and then dental visits. If you are diabetic, then you should also make it a point to visit your dentist as well because the diabetes can also get you into gum problems. The seventh complication of diabetes is sexual health complications. So if you are diabetic, then there could also be complications associated with your sexual health. There could be erectile dysfunction. In women, there could be reduced lubrication. So you know that during sexual intercourse, there should be more lubrication for you to enjoy the activity. And when there is reduced lubrication, it is going to affect you. There could be infections there, all associated with the diabetes. And then they are all caused by the nerve and the vessels issues that is causing the blood flow issues. So, what you have to do is to manage with medical support. You don't have to be ashamed of having infection or having low lubrication. If there is anything happening with you to your sexual health, then you need to seek the right help. You need to visit the hospital, let them know what is happening with you, and seek early treatment. Never become ashamed. That is why the hospitals are there, the health facilities are there to do. So take care of it and monitor it because diabetes can affect your sexual health. And then lastly, acute complications that can also happen. We are talking of DK, the kidney disease. We have the acute kidney injuries that can come with diabetes. They are all there. And then I want to talk about low sugar emergencies. Everyone that is diabetic should prepare for low sugar emergencies, hypoglycemia. All right. So, what happens when you are having a low sugar emergency? Shaking, sweating, confusion, loss of consciousness. So, there are people that when they have hypo, I hope you've heard of hypo, low blood sugar, they start to shake, they start to sweat, some collapse, some fall off, and then some becomes confused and some lose their consciousness. They are all things that talks about low sugar emergencies. Now, how do you manage your low sugar emergencies? You make sure that you have glucose or juice or sugary drink with you. I am summarizing prevention of complication. How do you prevent these complications? In summary, these simple tips are going to really help you keep blood sugar in target range. And then check BP and cholesterol. Your blood pressure is important from time to time, even if you are not hypertensive, because you are diabetic. You should be keeping an eye of your blood pressure and your cholesterol levels. Do not eat too much fat. I have always talked about diet. It is so important in managing diabetes. So check your cholesterol levels. Make sure you're not eating too much cholesterol because they are going to accumulate in your body and they can cause you a lot of problems. You need to stop smoking. If you are diabetic and you want to prevent yourself from these complications, then stopping smoking is going to help you. And then regular medical reviews is so important. Don't ignore checkups if you are diabetic, and it's going to help you to prevent yourself from getting a lot of complications. And then foot checks is very important. Check your foot always, every day. Make sure there is no wound on your foot. If there is wound, take the steps as early as possible. Then eye exams, make sure that you are checking your eye as well. And then you need to stay active. Now, complications of diabetes are not guaranteed. There are so many people that have diabetes, but they have lived so many years without getting any complication. So the fact that you are diabetic doesn't mean you are going to have complication with your eye or your kidney or your heart or anything. They are not guaranteed. If you take the necessary steps, you take your medications, you check your diet, you do exercise, and you do checkups, you make sure your blood sugars are in the range that is supposed to be, then you are going to be free and you are going to be prevented from these complications. And that is the good aspect of it. So, wrapping up, knowledge is power. The more you know, the more you are able to take good care of yourself. If you have any more questions, you can feel free to contact me, send me a message, the necessary bit at gmail.com, or you can chat me in the comments if you have any questions. If you have any experiences you have to share, you are welcome to share your experience. If you like this, I want you to like it. If you are watching on YouTube, at the necessary bit, I want you to subscribe for me and share to bless someone. Remember, every heartbeat tells a story. Bye.